welcome everyone here that's registered and joining us live. We appreciate you giving us your time. This is the BART Foundation. I'm Brian Cush, one of the BART Foundation board members, and tonight we're presenting our continuing webinar series focused around alternative therapies for brain injury survivors. The series explores safe alternative therapies with leading practitioners. And tonight we are excited to be joined by Dr. Ronald Stram, founder and director of the Stram Center for Integrative Medicine, who will also be joining with his colleague, Dr. Korey DiRoma. Tonight they will be presenting their perspectives on two cutting-edge therapies: Hyperbaric Oxygen Therapy, the benefits of HBOT and TBI, persistent infections, and post-treatment recovery. Additionally, the benefits and uses of Intravenous CBD, a breakthrough in CBD therapy. Also joining us as moderator is Joel Goldstein. He's a parent of a TBI survivor, author of No Stone Unturned, and the executive director of the BART Foundation. He will be moderating with me and joining during the Q&A session after the formal presentation. I'd like to formally introduce Dr. Stram. The Stram Center for Integrative Medicine in Del Mar, New York, was founded in 2002 by Dr. Ronald Stram, who is board certified in emergency medicine and a former regional medical director in emergency medicine at hospitals throughout the Northeast. The Stram Center collaborates with medical doctors, licensed multidisciplinary practitioners, nurses, and support staff, combining their diverse experience and service to the well-being of patients, their families, and the community. They are an affiliated treatnow.org clinic, providing HBOT treatments to veterans in the capital region for free of charge. Our co-presenter, Dr. DiRoma, is a licensed naturopathic doctor with experience in integrative medicine since 2007. He serves as a medical director at the Stram Center for Integrative Medicine in Burlington, Vermont, and specializes in naturopathic cancer support in the Del Mar, New York location. Since joining Stram Center in 2007, Dr. DiRoma specialized in integrative oncology, chronic inflammatory diseases, gastrointestinal dysfunction, metabolic and hormone disorders, Lyme disease, and mitochondrial dysfunction. He's known for his expertise in functional and specialized testing, as well as his implementation of natural therapies such as herbal medicine, IV therapies, and hyperbaric oxygen therapy. It is my pleasure, and without further ado, I'll turn it over to Dr. Stram and Dr. DiRoma, and I hope everyone enjoys the presentation.
Thank you. Well, thank you. Thank you so much, and it is truly an honor and a privilege to be here with Joel Goldstein and Brian Cush with the BART Foundation. I would say that Joel is a persistent pioneer and support for those with TBI and CTE, and he's an absolute gem to this community and to his service to those with TBI. I want to thank everyone in the audience for joining us. I want to first start, how did I get interested in hyperbaric oxygen therapy? I was interested in actually during my career as an emergency room doc, and because I found that there were certain conditions, carbon monoxide poisoning, where you'd have someone come into your ER, basically either half dead, almost dead, and then within a 36-hour period, they'd be strolling through the ER, completely recovered. It was that I saw sort of the miracles of some of the real dramatic issues where hyperbaric oxygen is known to treat. During my tenure in this field, which is really using integrative modalities for sort of severe or persistent chronic diseases, what I found is that when we started to use hyperbaric oxygen therapy, and we've now used it for the past 7 years, that it was really the game changer for how we improved patient care with the other treatments that we gave, whether it was oral therapy or those with PTSD, those with TBI, that we just didn't have the same benefit when we didn't use hyperbaric oxygen. So basically, you know, what is it that we do? This is our chamber. We have 3 of these big guys. They are steel chambers. These chambers specifically pressurized by using air. So there isn't really the flammability risk, which some of you may or may not have heard of, where there was a terrible accident in Michigan. This chamber would not have that happen because it pressurizes by air, and the mass that you get is 100% oxygen. When I was looking into this therapy, I didn't want to use the other chamber based on that flammability risk. It allows people to go into the chamber with computers, with phones, fully dressed with normal street clothes without any danger for any risk of flammability or combustibility. It's also a pretty large chamber. It's 4 by 8 feet. So you can really move around, sit up in it, move from side to side. We do have sometimes 2 people in it as either companions or even just 2 people using it at the same time. There are portholes so you can actually see out, and so we've had it. It is a steel chamber, and it's basically indestructible. The chambers that we have in the Burlington office are aluminum chambers, and they are as functional, but they do not go to the same pressure gradient that these chambers can go to. The difference is they can go up to 2.0 atmospheres, which is about 44 feet below the surface, whereas these actually can go up to 3 atmospheres, which is significantly more, 88 feet or so. So what are the benefits of hyperbaric oxygen? It attenuates the effects of hypoxia or low oxygen and inflammation in the brain. Attenuates basically means it reduces the effects of this low oxygen level in the brain, and we'll kind of go over the mechanisms. It reduces the need for mechanical ventilation. So those that are actually on mechanical ventilation, if they get hyperbaric oxygen, it actually reduces either the need or the duration. It improves oxygenation in chronic respiratory infections. This was found with long COVID and COVID, and what we've seen in those people that may have atypical persistent bacterial infections of the lungs and also fungal infections. It decreases the oxidative stress, and it improves cognitive function. And this is seen no matter what condition you may have. Most people feel after therapies that they have better memory, better comprehension, and so it does, attenuate and reduce those effects of even aging. And so what are the mechanisms of action? And Henry's law is basically, it's about diffusion. And as you increase the pressure on a gas, it makes the gas smaller. That's Boyle's law. But what it does is by this diffusion capability, so if you make the molecules of the oxygen smaller, they actually can go into tissue better. And so it can go into the alveoli, which are those little bubble things that help the lung to breathe better. Because if you're inflamed, then that inflammation itself reduces the blood flow capabilities. Capillaries are reduced, arterioles are reduced because it's inflamed, the blood can't get through. What happens with hyperbaric oxygen is that diffusion then just penetrates into the tissue beyond the need for those arterioles or the arteries themselves, because it goes directly into the tissue. So it then is within tissues and fluid that don't necessarily are seen as having oxygen delivery to them directly. It would be indirect through these capillaries and veins and arteries. And so it's seen in places like the spinal fluid and in plasma and in joint spaces. And this is unique. So there's a really interesting kind of a crazy study that was done, but it was done with about a dozen rabbits. And they took a dozen rabbits and they put them in a hyperbaric oxygen chamber, and they put them onto actually a very high pressure, about 3 atmospheres of pressure. And when they were under that 3 atmospheres of pressure, they put an IV in them. They took that intravenous catheter in their vein. They withdrew all their blood and put back just saline. So no hemoglobin, nothing that would carry oxygen. The rabbits survived. They had no change in their behavior under hyperbaric oxygen therapy. And that's sort of the remarkable benefits of this use. Now, of course, when they went up to pressure, they didn't have any blood in them. They didn't live. So it increases this hemoglobin oxygen saturation when the saturation is low. And that's what you're seeing in this chart here. It's showing this chart of patients that had respiratory failure with COVID. And when they were actually under treatment, this is, you see their saturation level just significantly improved, from 70 to 92, 93%. So you're already starting the healing of tissues immediately when instituting hyperbaric oxygen. So it improves this oxygen to the surrounding tissues. And this is now the Boyle's law, which is basically as the pressure increases, right? As the pressure goes up, the volume decreases. So as the pressure increases on a gas, the gas bubbles actually decrease in size. And some of you may even just recognize this. If you have a soda machine, the soda machine comes with a CO2 canister, and the CO2 canister is gas, but that gas is put under very high pressure, and that high pressure then will allow you to hold that canister, but it's liquid. And when you put that tube into water, that water then becomes a different mixture now of CO2 penetrated water. If you took CO2 and you just blew it past the water, not under high pressure, it would just go to the top of the surface and not actually join into that water. And that's really the idea of how hyperbaric oxygen works with oxygen delivery. So what are the antimicrobial mechanisms that we see? So the antimicrobial mechanisms are that essentially it produces these reactive oxygen species. They include the superoxide, peroxide, hydrogen radicals, hydroxyl radicals. And what it is with bacteria, they lack these antioxidant defense pathways. Now, that is very specific because we want to target that when we try to augment the effect of, let's say, antibiotics in the treatment of chronic infections. And in our practice, we have a significantly high rate of those with chronic infections, those with tick-borne illness or Lyme disease. And so part of this is that the effect of hyperbaric in and of itself acts as an antibiotic. And so it causes this sort of reactive oxygen species, and it affects these both viruses and bacteria in disrupting its ability to replicate. And so this is another, this is a study that was done for antimicrobial mechanisms and the clinical applications. And this was one of the reasons why I also looked into hyperbaric oxygen, because when we were treating those people with chronic persistent infections from Lyme disease and their co-infections, we had a significant number of patients that had neurological Lyme. And neurological Lyme can be devastating. It can pose as what looks like new onset dementia. It can give people musculoskeletal dysfunction, movement dysfunction. And what I found was IV therapy, which is the highest delivery mechanism to get intravenous therapy for antibiotics, the application alone would give some benefit, and we'd get a number of benefit from it, but the duration of treatment was long. We would have to treat people sometimes up to 6 months, 9 months, or a year. And with hyperbaric oxygen therapy, we found that treatment duration was cut down to anywhere from 50 to 75%, so that you could treat people sort of on an acute basis over a 4 to 8 week period using hyperbaric in addition to those other therapies, and their recovery was significantly faster. That's one. The second is that the depth of their recovery was much greater. So neurological symptoms were much more reduced when using this therapy. And if you have people that, let's say, have these chronic persistent infections and also have TBI, those with sports injuries, it's not uncommon that golfers or people that are exposed to ticks when they play sports, if they had head injuries, whether it's from soccer, football, you'll see that these, if you combine those therapies, that is where we see the biggest benefit. So what we see, and this is specifically with Lyme disease, is what's called a microaerophile. So micro means small, aerophile is air-loving, but they're small air-loving. So the normal oxygen in the air is about 21%. But microaerophiles, they actually like to live at about a 2 to 10%. So that's why they typically, and specifically with Lyme and some of the co-infections like Bartonella, they don't like living in the blood. They don't like to actually have that kind of oxygenation. So they look to be stealth and get out of your system and get out of your bloodstream and get into your joints or into your muscles or into your brain or into your spinal cord, where the oxygen level, the oxygen tension is lower. And so they grow better. When we use hyperbaric oxygen, this directly affects them. So we are directly causing an antibiotic effect by using hyperbaric oxygen. And it's, again, I'm going to say, we have found this modality of treatment has been a game changer to our practice. And that's why when we opened up the Burlington practice a few years ago, the first modality that we did was we had hyperbaric oxygen therapy there in Burlington. And now TBI is traumatic brain injury. It causes damage to the brain cells. It leads to reduced oxygen supply and inflammation. And hyperbaric oxygen treatments, which again, as we spoke of, involves breathing pure 96 to 100% oxygen in a pressurized chamber. Like I said, ours is an air pressurized chamber. And what it is it's used to increase the amount of oxygen in the body, but particularly in the brain. And so with TBI, it is, there are mechanisms TBI. It's not just a direct force, a direct blow. That's kind of, that's an obvious blow. But there's also blast injuries, which can be like shell shock, and people have heard of that. It's this high pressure wave. The high pressure wave, it causes in itself any area that has any fluid, like the brain, it causes it to ripple. But if it ripples, and it ripples within a closed space like your skull, there's nowhere for it to go. So it's almost like a wave that waves across your brain, and it hits against the other side of your skull and then ripples back. And that's actually called a contra-coup phenomenon, meaning you can have the insult that happens on one side, but the effect can happen on the opposite side. So usually what happens with TBI, and TBI can be mild concussion to severe. And this is where you'll see the gradation or the spectrum of symptoms. Physical changes such as changes in motor skill, hearing, vision, generalized confusion, weakness. Typically, you see people where People say they don't sleep well, they have irritability, they have difficulty with having a restful sleep, they have difficulty in understanding, in communicating, short-term memory problems more than long-term. And then there's sort of the subtle changes. And these are what we see sometimes with PTSD, that post-traumatic stress disorder, is that you can have these sudden changes in mood, these volatilities, these quick to anger, personality changes, difficulty in social situations because there's this overstimulation response. I liken it to, every response out in the public feels like you're going into Walmart, where all these lights and a lot of this exposure, and it can make people feel very anxious and overwhelmed, overstimulated. And then, of course, that's a change in your behavior, and it then leads to depression and suicidal ideation and suicide, period, because it becomes so difficult to function. And certainly that is something that we have seen. And part of our practice is that we have mental health counseling in our practice, because we recognize that has to be part of the issue with any kind of chronic condition, to have people feel supported in many different ways, not just in the direct effect of treatment. That treatment is beyond just treatment on the physical, but also treatment on the emotional and the personal. So the effects of hyperbaric oxygen on inflammation, it's pretty dramatic. It's pretty impressive. It downregulates these cells within your system that cause inflammation, these cytokines. It suppresses these pro-inflammatory cytokines. It reduces tumor necrosis factor, alpha. Now, some of them actually, tumor necrosis factor, which can eat away at bad stuff and get rid of sort of debris from metabolic or metabolites of inflammatory proteins. You want some of that so it actually activates ones that clean up and reduces ones that cause further inflammation. And then the pretty dramatic effect is this increase on VEGF. And VEGF stands for vascular endothelial growth factor. And vascular endothelial growth factor is the making of new blood vessels. And this is a dramatic response. This we see after a number of hyperbaric sessions. It doesn't just occur after 5 or 10, typically not until after 20. And what that is because of this increased amount of oxygen that is coming into your system, the body doesn't know what to do with it. So it says, well, we need to create more of a nesting area for this oxygen to settle. So it actually creates more blood flow and blood supply. So people with TBI, or even strokes or heart attacks, anywhere there is a reduction in blood flow, a reduction in tissue penetration of oxygen, not no penetration, right? If tissue is dead, you can't revitalize it. But oftentimes, the tissue is not dead. Oftentimes, in any of these issues, whether it's stroke or heart attack, there is the initial insult of the area. So it may be this part of the tissue, let's say the tip of my finger. But the periumbric area, and that's the area beyond that direct insult where there's no blood flow. The periumbric area is the area that is inflamed, that still has blood flow, but has a reduction of blood flow, a reduction of functioning. That's where hyperbaric has the most benefit. And we'll show you sort of some of the results of that with what's called SPECT studies, but it's pretty dramatic. And then it decreases this prostaglandin and COX-2. Now, people don't know what that is, but what it is COX-2 inhibitors, like aspirin, reduce that inflammation. prostaglandin E2 is blocked by Motrin, ibuprofen. So it actually decreases that inflammatory markers, those inflammatory proteins. And this again is now a study that was done with hyperbaric and oxygen on stroke patients. This was 162 patients that had strokes of all different types. And this is showing that in the treatment arm, 86% of them received clinically significant improvement in all cognitive domains. That's pretty dramatic. There is nothing else that can be done that is that dramatic. There is no drug that can do that. But people that have, these are post-stroke, this isn't like, this is, you did all you can, this was the stroke, and this is the function. And it's a pretty dramatic. And this is the study that was done, and this is the, so you can see on the blue side is the control group, and the control group was basically, they had, limited treatment, but even the control group that had, let's say, no difference in functioning, they had no issues, they were just a control group. Even the control group, so they had no stroke, they had no other damage. Even the control group showed better information processing speed, memory, executive function, and intention. So this is where we see even those that are well, and that's why in the wellness community, and you'll see it from the sports people, where they'll use this not only for injury recovery, but also for focus, for executive function, for attention. And now on the other side, you see the baseline of the treated group, where there's a significant improvement between the baseline of the treated group and those that got treatment themselves. And again, this is the general cognitive score, and this is the baseline of the treated group versus those that were in the treatment. And again, you'll see that those in the general control group still had improvement. So, quite remarkable. This is a SPECT scan, and a SPECT scan looks specifically at uptake of blood flow using radioactive blood sugar. And so, if you look at the top of the image, you'll see there's a lot of red and yellow and some green, and you'll see the red and yellow is there's blood flow, but the white below, which is the post HBOT, the white below shows the maximum delivery of oxygen and of tissue regeneration. And, it's pretty dramatic. And this is, again, showing the same post HBOT baseline, that there is a significant change in the look over. And if we look here, this is the control group, and here the control group of these stroke patients. In this, the control group, they're in the green zone, and they have a significant reduction. After you have HBOT, look at all the blood flow that has improved within that area of the brain. I mean, it's dramatic, and I'm going to say that we have had dramatic results. I mean, this isn't like, there are times that we will have people that were, non-functional, that after hyperbaric became functional, and some back to their previous state of wellness. So, I think that it is, and Joel and I know about this, but it's a remarkably underutilized tool in the general medical field. It has too limited of a scope of application, which we believe should be broadened to those with immediate use in TBI patients, immediate use post stroke patients, or even post heart attack patients. Those trying to recover faster from surgery. There's a number of benefits using hyperbaric. And the next I'm going to take this over to my colleague, Dr. DiRoma, and he's going to talk about the benefits of CBD.
Thank you, Dr. Stram. That was great. So why CBD? Well, CBD, cannabidiol, it has activity in the body because we have something called the endocannabinoid system. So we have receptors for CBD that actually affect all systems of our body. And why we are particularly using it is because it has a profound effect on inflammation. And as we heard Dr. Stram talk about inflammation, one of the uses that we're using hyperbaric oxygen therapy for is to actually reduce inflammation. And oxygen has that capacity. So in a sense, when we're using CBD therapies, we're also trying to reduce inflammation at the same time. So cannabidiol is essentially a non-psychoactive compound. So it is part of the marijuana plant, and what makes marijuana psychoactive is actually the THC component. But CBD in and of itself doesn't have psychoactive properties. So why use IV versus oral? Well, IV has much higher bioavailability than oral CBD. In fact, oral CBD may only have about 10% absorbability through the gastrointestinal tract. And so if, for example, if you're taking an oral dose of CBD that's 200 milligrams, you may only actually be absorbing about 20 milligrams of that. But with IV CBD, since there's really no first pass through the liver, we actually know the dose that we're giving, and that's actually going to be the dose that's in the system. So if we're giving say like a 30 milligram dose, then we know that exactly 30 milligrams is going into the system, and then we'll know what the effect of that is. Now, people do have varying effects from CBD, so we monitor dosing very closely and what the effects of that dose are over time to really determine the proper therapy for that individual. IV CBD also has a much faster onset. And oftentimes when we're giving it in the clinic, especially if we're giving it for anxiety and anxiousness, then we see almost an immediate calming effect, and our patients actually tell us that they feel better actually during the infusion. So it has a very, very rapid onset. So some medical applications of CBD, it certainly has again some anti-inflammatory and pain properties, anti-pain properties. And so oftentimes we can use it to reduce pain in certain situations, like for chronic pain. One of the sort of the primary mechanisms for how it reduces pain is actually through certain types of receptors like serotonin receptors and activation of another receptor called TRPV1. It's also used in anxiety and PTSD management. So for individuals experiencing severe anxiety or PTSD, oftentimes we can see that IV CBD can rapidly cause very calming effects. Because of its anti-inflammatory properties, it has certainly been looked at for use in anti-cancer therapies as well. So CBD has been shown to induce cancer cell death, which is actually known as apoptosis. It can also inhibit tumor growth and metastasis as well. Some studies have demonstrated that CBD can actually suppress tumor growth and reduce metastasis, and this is in animal models. And it can actually help enhance chemotherapy effects, and CBD can actually be synergistic with a lot of chemotherapeutic agents. Now, oftentimes in our practice, we're actually using CBD alongside other IV therapies that we know to actually either be anti-inflammatory or have anti-cancer properties or have pro-oxidant properties. And that's one of the benefits of also utilizing hyperbaric oxygen therapy along with these therapies, is that that pro-oxidant effect that the oxygen can cause can actually have damaging properties to cancer cells. And so oftentimes we're using hyperbaric oxygen therapy in our cancer therapies alongside IV CBD and high dose IV vitamin C as well. CBD can also help with detoxification support and also help the immune system as well. So some safety considerations. We have found that in our dosing so far, we haven't had any of our patients have any significant side effects with IV CBD. At the higher doses, we have seen very, very, very slight sedation. And I would say that that's not necessarily drowsiness that we've seen, but just sort of more of a relaxed state. It can interact with certain medications. So it does have, as I was speaking of before, it does have some activity against receptors and on certain serotonin receptors. So there is some caution in using high dose IV CBD on those patients on antidepressants or those types of medications. All right, so that concludes our presentation, and then we can open it up to questions.
Thank you, Dr. Stram and DiRoma, for an excellent presentation. And I want to personally thank the Stram team, who some of you know treated our son BART with very good effect for many years, and he loved the Stram Center. So I do have a few questions I'd like to throw out there. One would be, what conditions would you say are counterindicated? When would you not advise HBOT or the IV CBD?
So I think there is a direct contraindication with HBOT in the use with people with something called bleb emphysema, which is that you have lung tissue that blows little bubbles. They have little damaging bubbles, kind of like when you have a tire tube that becomes defective, and it becomes, it has a weakness in the wall, and that weakness becomes like a bubble. So that means that any kind of high pressure could potentially blow out that bleb. Now, we typically screen for that, but if anyone has that in their history of what's called pneumothorax, where they had actually a collapse of their lung that may have been spontaneous, meaning it didn't happen from a direct injury, those are people that we would have to look at to see if they would have that as direct contraindication. That's actually a contraindication. So that's the major, but it's very rare. It's a rare contraindication, and those that have it typically have had it already treated. Some minor or some, major could be major. So if you have extreme claustrophobia, If you're in a chamber, the chamber is like an airplane. The door closes, you can't just open the door. It takes, to depressurize, it takes 1 to 2 minutes, and that's a rapid decompression, which means that if you're not used to it with your ears, it can hurt. But for some people that have just extreme claustrophobia, they typically can't get into the chamber, or you can get into the chamber, you just can't close it, which means you can't use it. The other is barotrauma, which is where people get high pressure in their ears and are very sensitive to the pressure, and their eardrums can actually burst. Now, it typically is recoverable. It typically, it can burst, but then it heals within a few days to a week. And those, we take as much precautions to prevent that by slowly, increasing pressure, by teaching people how to, decompress with using their nose and to blow out so that they equalize pressure, chewing gum, drinking water, wearing noise canceling headphones or earplugs. But that's kind of the major contraindications in that. With CBD, I'm gonna let you, but CBD, there are some people that if they're on certain medications, it can add to the sedative properties of medication. So if someone's on, high levels of opiates or things like that, it can add to the sedative property. Now, CBD in itself has no effect on respiratory drive. So it doesn't matter. You can give you can give a super dose and it will not affect the respiratory drive. However, if someone's on an opiate and a high amount of opiates and it augments that effect, you'll reduce that respiratory drive because it's going to augment that effect. So, those are some of the, that's one of the major contraindications. And some people can be allergic. I mean, they can have a reaction to it, just like any other medication. It's given intravenously, so you typically know if there's an allergy response immediately, within a few minutes. But those are the known contraindications. And what we found is that for the most part, the results of using CBD can be seen at the lower doses. And, so there's CB1 receptors and CB2 receptors. CB1 receptors are very specific for the brain. So those receptors, really, it has an effect on this anxiety reduction, this reduction of inflammation. And then the CB2 receptors are affected on the immunological system, so it actually reduces inflammation. And we've seen this as a benefit because that CB2 receptor, the highest amount are actually in the gut. So what we've seen is that for people with even ulcerative colitis, Crohn's disease, that it can reduce the symptoms of Crohn's disease with that. So,
right. So that's sort of its very strong anti-inflammatory effect that it can have.
A question that was, it's coming twice now, so I want to try and get it out to you folks. This individual asked, a patient in a vegetative state, can they get the HBOT and would it be beneficial for them?
So, so logistically, it's a challenge because logistically, if they're in a vegetative state and let's say they, if they're on a ventilator or they're on a feeding tube, then it's a logistical issue, right? Because the way that the HBOT is, you need to get in it. Now we have a stretcher that we can put someone in it, but if they're on a ventilator, that means that you have to bring the ventilator into the chamber, And I'd say logistically, it is very challenging. If they are not ventilator dependent, then yes, then you could do it. But if they are ventilator dependent, you probably need a walk-in multi-place chamber, not a single chamber.
A follow-up question from another individual. For someone with a TBI, is it too late for HBOT to help the individual several years out from the acute phase?
So that's a great question, and one that I definitely have an answer to. We had someone who had a TBI 20 years previously, was a skilled artisan, made violins and mandolins, couldn't do it. Had a TBI, had been functional, but really limited functionality. Did 25 dives, so not a lot. And after the 15th dive, started to have the ability to use that functionality, and the quality of life was dramatic. It was a dramatic response. So what we have found is that, again, if there is still blood flow, it's limited blood flow, HBOT will work no matter when. It'll work. And we've had people that were, fell out a window and had TBI significantly 6-7 years previously. They did HBOT and their functionality improved significantly.
That's terrific. And I'm a long-suffering New York Jets fan, and I have.
So sorry to hear that.
Yeah. I had the pleasure of meeting and speaking with Joe Namath, and so did my son, on several occasions. And he reports, and you can see him selling insurance and other things on TV. He was suffering some fairly severe dementia several years ago, meaning roughly 40 years post-injuries, post-CTE, and he largely recovered. He's got a new career as a salesman. So that's decades later. I wanted to just throw that in. What would you guesstimate for, if you can, for a typical PTSD survivor or a TBI survivor? How many treatments or dives would they happen to have?
I mean, so what we have seen, and this is from what our experience is, with people that have injury, the first 10 treatments are rough. You typically do not feel great with the first 10. You're like, wait a second, how come I'm getting all this oxygen? I should walk out of there and feel like Superman. And it typically is the opposite. It actually is very fatiguing. People feel drained because your body's not used to it. And there's a lot of regeneration, recovery. And so we say the minimum of something like that is typically 20 dives. And that's what we recommend. Yeah.
What about for Lyme? Number of treatments, would you guess?
So similar is that for Lyme, if we pair it with either oral antibiotics or IV antibiotics, again, minimum is between 20 to 40. That's kind of the minimum. And essentially what we do is, the staff here make sure that, gauges their improvement. And sometimes what you can do is the benefit sometimes, and this is not even sometimes, but oftentimes, is after the treatment. So sometimes what you can do is you do 20 dives and you say, okay, look, let's take a break. Let's allow the body's recovery and regeneration period to occur. Let's give it a week or 2 weeks and see. And oftentimes people after that break period feel the improvement, even more so than they did during treatment. And that's a lot of people will feel, I was wiped out by the end of the week, but actually on, Sunday, I felt significantly better. So I hope that answers.
Good. And with the CBD treatments, would you say how many would be required in a useful series?
Well, that's a great question, because as I was saying earlier, that everybody's response to CBD is a little bit different. So oftentimes we may recommend starting with 1 or 2 IVs per week, and then do that on a weekly basis. But again, we have to monitor for symptom improvement and what the symptoms are and how long we're actually getting symptom improvement for. So if we're giving a certain dose of IV CBD on, say, a Monday, and that patient reports, well, I felt great for an entire week and through the weekend, but then I felt my symptoms sort of coming back towards the end of the weekend, then we know that, that we can dose it again in the following week and still have fairly good coverage, versus somebody who's saying, I had great effect for a few days, then that person may need more frequent treatments.
And it's a new therapy. I mean, intravenous CBD, I mean, it's sort of pioneered more on the West Coast. I think we're one of the few clinics on the East Coast that are using it. And so we're still collecting data. What we would say is probably, 4 to 6 treatments to see if it has a benefit. I mean, what we want to do is when we use something, we want to see if it has a benefit. But the other is we want to see if it has a cumulative benefit. It's not just, I feel better, because I'll tell you almost universally, people feel more relaxed. It absolutely is a pain reliever. So it will relieve pain. I mean, it really seems to do that very effectively. Which is great, because it's a non-narcotic. It has no, it's not a COX-2 inhibitor, so it doesn't affect the gut in terms of ulcerogenic. So it has a lot of benefits. But what we want to see, it's cumulative effects. So that is still, we don't know. Like, we're using it now for someone with Crohn's disease, and that is a direct effect where we can actually examine, and if the tenderness is reduced, then we know that it likely is having effect. And what's going to be better yet is to then have a follow-up, let's say colonoscopy, and see if the inflammation or the ulcerations have been reduced while not changing any medications, like just CBD. So that and that's still, it's new for us, and so we're still in this sort of new stage of its use, but it's exciting. I mean, I think for us and in this space, we continually are trying to look at ways to improve the quality of people's life, but also be able to affect disease outcomes. I mean, that's really the goal.
Thank you both.
Well, I want to thank you, and thanks for providing this education for the people in this space. And again, your work is terrific. Thank you so much, both of you.
You bet.
Yes,
Thanks.
thank you for having us.